Hello everyone. So root canal treatment, it is always accompanied by pain. So during root canal treatment, I need to control the pain to achieve proper results. So for gaining the confidence of the patient, I need to control pain, even either preoperative or intraoperative or postoperative. Preoperative, I can start giving my patient non-steroidal anti-inflammatory or analgesics before even start the root canal treatment. This can potentiate the action of the local anesthesia I'm going to give during the root canal treatment. Intraoperative, it can be reached, or the control of pain by during the root canal treatment, it can be reached by proper administration of the local anesthesia. Proper technique, and either primary technique or supplemental technique, and proper administration of the local anesthesia. And post-operative, it can be controlled by proper administration of the analgesics. So to gain the patient confidence during the root canal treatment, I need to have the 3 Ds. What are these? I need to have a proper diagnosis, proper and accurate root canal treatment. This means proper access cavity preparation, proper preparation of the root canal, proper irrigation of the root canal, proper isolation, and finally, drugs could be a very useful or a proper adjunct to me during the root canal treatment. But the main concern, it will always be the definitive treatment you are going to do. So we can give analgesics post-operatively or pre-operatively, as I mentioned, to increase the effect of anesthesia. Studies have showed that giving non-steroidal anti-inflammatory like 2 hours before treatment, or before dental treatment or before root canal treatment, it can potentiate the action of the local anesthesia. So during post-operative or after we finish the root canal treatment, we need to always prescribe analgesics. What are these analgesics we can give? Analgesics, it can be divided into non-narcotic and narcotic analgesics. The non-narcotics, we can give the non-steroidal anti-inflammatory, the acetaminophen, and the corticosteroids. And there's the opioid drugs, which is the narcotic drugs. So the non-steroidal anti-inflammatory, it can offer an anti-inflammatory action. It will decrease the synthesis of the prostaglandin, which is the pro-inflammatory mediator. It would increase the inflammation process. So by giving non-steroidal anti-inflammatory, it will decrease the synthesis of prostaglandin, and this will decrease the inflammation and will decrease, of course, it will decrease the pain. One of the most common analgesics prescribed by us and one of the most potent analgesics, of course, is the ibuprofen. Okay, so the ibuprofen, it can be given as a 400 to 600 milligram 3 times per day. So after I finish the root canal treatment, I can give like 400 or 600 milligram of ibuprofen following the root canal treatment or following the instrumentation procedures. Another drugs, which is the acetaminophen. Acetaminophen, it can be a very important substitute in cases where I cannot give non-steroidal anti-inflammatory or ibuprofen, as the cases, for example, of the patient of kidney diseases, or the patient with a pregnant lady, or the patient with gastric ulcer. All of these are contraindicated to give for them non-steroidal anti-inflammatory as the ibuprofen or the diclofenac. So as a substitute, I can give here acetaminophen. I can give from 0.5 to 1 gram. The maximum permissible dose for acetaminophen is 4 grams per day. Regarding the profen, the maximum permissible dose, it's about 2,400 milligram, 2.4 grams of ibuprofen. There are some drugs which combine both, which combine acetaminophen with non-steroidal anti-inflammatory, acetaminophen plus ibuprofen, like for example Advil, okay? Or there are some drugs that combine acetaminophen with other narcotic or opioid drugs, as for example codeine and caffeine, okay? This is for more control of pain. A very important way of management of post-operative pain is this flexible analgesic strategy. You can find that this strategy, it have divided the dose and the drug you are going to give according to the severity of the case. As for example, for the mild pain, you can give like 200 up to 400 milligram for this case. If there's mild pain, like mild pain on biting following root canal treatment or following instrumentation of the root canal. If the pain is moderate pain, okay, so I can double the dose. I can give like 400 milligram, I can give like 600 to 800 milligram, and I can give, in addition, I can give acetaminophen with this ibuprofen. For the severe cases, I can merge ibuprofen with opioid drugs or with acetaminophen. I will give like a combo of the three drugs: ibuprofen, acetaminophen, and usage of opioid drugs. These are the way for the management of the patient that can tolerate aspirin or that can tolerate aspirin-like drugs, as for example the ibuprofen. If the patient cannot tolerate these drugs or contraindicated to give him these drugs, so I'm going to rely mostly on the acetaminophen. Like for example, I'm going to give 300 milligram of ibuprofen or 500 milligram of acetaminophen for the mild cases. For the moderate cases, I'm going to merge between acetaminophen and drugs like, for example, oxycodone or opioid drugs, or tramadol, for example. Okay? In the severe cases, I'm going to double the dose of the acetaminophen and increase the doses of the opioid drugs. Another important issue is the antibiotic. Do I need to give antibiotic during root canal treatment? The question is that the answer is that antibiotic maybe can be required for some cases and maybe not. So me as a clinician, I should know when to give antibiotic and when no need to give antibiotic. Antibiotic can be given in the cases of acute apical abscess in immunocompromised patients. Not in every case, in the cases of immunocompromised patients. Cases with acute apical abscess, if there's an elevation in the temperature, if there's a lymphadenopathy, okay, if there's a trismus, which means extension of the infection to the muscles of mastication, if there's a progressive infection like a cellulitis or osteomyelitis, or rapid onset of swelling, if it is increasing very rapidly. If there's a persistent case, persistent infection, I have done all what I can do. I have irrigated the canal, I have prepared the canal, and still there's an infection that cannot be removed. So in this case, maybe I will need to give antibiotics. Many cases you cannot give antibiotics, like pain cases, okay? Pain without signs of symptoms of infection. Okay, the patient came to your clinic complaining of pain. This pain could be due to symptomatic irreversible pulpitis or symptomatic apical periodontitis. Both of these cases, I cannot give antibiotics or could not be managed by antibiotics. Teeth with necrotic pulps and radiolucency. If you have a radiolucency and the case is necrotic and the patient is not complaining, no need to give antibiotics, okay? It will rely mostly on the endodontic treatment you are going to do. A tooth with a sinus tract, a chronic apical abscess, no need to give antibiotic. Okay? A localized fluctuant swelling, no need to give antibiotics. Just do incision and drainage for this case. Thank you, everyone. I hope you have enjoyed this small lectures, and see you in another lectures. Thank you.